Welcome to the third webinar. I'm very excited to be hosting this third webinar. My name is Will Partlett. I'm an associate professor at Melbourne Law School, also a member of the Constitutional Transformation Network here. And really excited to be looking today at a set of really interesting and important questions that I think overlap and in many cases have very interesting parallels with many of the things that we've already discussed in the first two webinars. So today we're going to be talking about the relationship and the interaction of multi-level government during the coronavirus pandemic. And I think this does draw on themes and conversations that we've already had. In the first webinar, we talked about the role of emergency powers. And I think the use of emergency powers, as we're going to see across these different case studies, has actually played a role in determining the relationship between the different levels of government. Also, there's a really important relationship. Multi-level government also in many cases has played an important role in representation as well as in deliberation in many cases, as different levels of government debate the best ways to approach and to respond to the challenges of the pandemic. So I think we do see overlaps with the second webinar, which looked really at questions of lawmaking, accountability, and representative government in the pandemic. So, and in general, I think it's interesting, and interesting to think about and to see how the COVID crisis puts political and constitutional systems under significant stress, and we learn a lot about them in those moments of stress. And we see, areas where things are working, where things are not working. And in this case, looking at multi-level government, the four examples and four kind of primary papers we're going to listen to are all federations. So we're going to be thinking and listening to how it works across the four federations in today's session. But I encourage, once we get to the Q&A and opportunities to have a discussion, to discuss other types of governments that may not be federations, but also are multi-level government, and see how they're responding and how there might be parallels and interesting overlaps between the two. Some important themes that I think we're going to discuss, and then I'll stop and open up, is to think about how different branches of multilateral government interacted with one another. What was it, cooperative? Was it not so cooperative? Was it kind of competitive or antagonistic federalism, or was it more cooperative federalism? And how did the pandemic really impact that relationship? What was the effectiveness? We've seen generally that even though there has been a move towards centralization in some parts of the world, that often in many countries, subnational governments, local governments have actually ended up playing a very important role, just a necessary role, because they're the ones closest to the pandemic and are most able to deal with particularly local outbreaks and so forth. So we're going to think about those types of questions. And the final question, which I think all of the papers really point to, is to what extent was multi-level government itself positive, negative, or did it have mixed effects? So we'll be thinking about those questions as well. So what I'm going to do is follow the order on the outline, which is to start. We're going to start with. So I'll start with Twomey, Professor Twomey from the University of Sydney. Any of you from Australia and from other parts of the world would know her as writing a number of important books and articles on Australian law, comparative law, public law, from all kinds of different perspectives. So without any further ado, I'll hand it over to Anne for a story of COVID in the Australian Federation.
Thank you very much, Will. Just checking that you can hear me. Yes? All good? Excellent. Yep. Thank you. Okay, so to start off in Australia, I think the most interesting thing I found when I started looking at this issue was the extent to which there were very high levels of cooperation and planning before the pandemic. So I don't think you could say that Australia was caught completely unawares. In fact, there were so many plans and documents and the like. I actually thought it was the reverse. In some ways, it was over-planned. There were enormous numbers of intergovernmental agreements in relation to health, potential pandemics, emergencies. There were large numbers of cooperative bodies, and it made me wonder how much they would work in reality. I have to say, in my previous experience working in government a long time ago, I worked for the New South Wales government at the time of the Sydney Olympics, and we were planning for some kind of emergency crisis then, a terrorist attack or something or other, and we did all these exercises like they did in relation to the pandemic. And I do remember one government minister saying to me at the time, well, this is all well and good, but if an actual emergency happens, we'll take over. You know, so the problem with this is the reality sometimes overtakes all the planning, and I think that partially happened here. So yes, there was an awful lot of planning. The problem with the planning, however, is always that you can never know the exact details of what's going to happen when a pandemic occurs, because each type of disease is different, it spreads differently, the health issues are different, and the economic issues are different. So regardless of how much planning you do, more needs to be done once it hits. And that's certainly what happened in Australia. So since the pandemic occurred, we have had other intergovernmental agreements that have occurred, other new cooperative bodies that have been created. And that's, you know, natural. It would certainly happen in any case, I imagine. Probably the most significant change was the establishment of what's been called National Cabinet. So that was a collection of the leaders of the various states and territories and the Commonwealth. And the idea there was to supplant the existing body, COAG, the Council of Australian Governments that did that type of work, by making a much more flexible model. And it was more flexible in that it met quite frequently. It did it by video conferencing, so you didn't have all the drama of everybody heading to the one place and travelling and wasting a day. You could have your meeting in an hour, be in and out and done. And the more frequent the meetings were, the more likely it was to achieve some level of ability to deal with a very quickly moving crisis. We found a number of things that occurred. The first was that because when the crisis really did hit, it was so fast moving and so desperate that we got quite high levels of cooperation between the Commonwealth and the states, more than we had ever really seen before. And everybody thought this is a marvellous thing if we could just keep doing this. But it did begin to fray later on. But it did show that if you have extreme emergency and a single goal, that the federal and state governments could cooperate well to achieve that. I think the other really important thing there was that they had consistent advice upon which they were drawing on to make decisions. So that advice came from the Australian Health body that had all the heads of health in the different jurisdictions. And there was one set of evidence that all jurisdictions contributed to, so that one body of evidence was being used to inform decisions, and that made a really big difference. And that's something I think that we need to continue with in the future. So the other key thing from federal cabinet, national cabinet, was that it did allow each of the states to implement the decisions of national cabinet separately, according to their own circumstances. And in a very large country like Australia, where the circumstances were very different amongst the jurisdictions, that was really important. Things did, however, begin to fray. There has been breakdowns to some extent in that cooperation. We've seen that particularly in relation to closures of borders. So a number of states closed their borders in order to be able to protect their own people and to be able to open up their own economy so that people could go to cafes, etc., without restriction, because there was no COVID-19 in the jurisdiction. We've seen that happen in Tasmania, we've seen that happen in Western Australia, and to a lesser extent in Queensland. The federal government, however, doesn't like that, because it does have huge economic impacts on the country. So been significant conflict in relation to that. Equally, there was a bit of conflict and blame shifting in relation to aged care between the Commonwealth and the states. So that initial cooperation that we saw in National Cabinet has begun to dissipate, partly because the intensity of the emergency has passed, partly because people are getting sick of restrictions on them, particularly my poor colleagues in Victoria, and partly also because elections have begun to intervene as well. So in Queensland, an election is forthcoming, and that has caused various governments to become more partisan in their criticism of governments of a different hue to their own. So that's made an impact as well. I see my 5 minutes are up, so I'll cease there and move back to Will.
Thanks, Anne. I mean, one fascinating thing that comes out of your paper and that has really characterized Australian responses is the rise of the national cabinet. And I'd be really interested in getting, as we move to the discussion phase, to talk about whether other parts of the world have seen similar new institutions emerge, which at least in the beginning of the Australian National Cabinet was viewed as a really, as a kind of, this is going to really change things, and it may not in the future, but it's an interesting kind of how institutional innovation might be actually emerging from this as well. Okay, so we're now going to turn to Nepal and hear from Budhi Karki. Turn over to you.
Nepal, as you know, is a new federal country with 3 spheres of government. We have 7 provinces and 753 local governments with their own exclusive and concurrent powers as well. But the COVID response has been so far very nationally led by the federal government, where the provincial and local governments work as instructed or guided by the federal government. So it's the response, COVID response in Nepal, although it's a federal country, is not federal. It's more unitary. So as soon as the first COVID case was confirmed in late January, the federal government formed a high-level coordination committee to lead the COVID response. It was led by the Deputy Prime Minister with other 8 senior cabinet ministers of federal government. It did not have any provincial or local representation. Later on, within a month, the government again formed a crisis management center to respond to COVID, expanding its membership, again led by the Deputy Prime Minister, and asked the provincial and local governments to form the similar structures in line with the crisis management center in federal level. So basically, the provincial and local governments formed their provincial and local government crisis management centers led by the chief ministers in the provinces and chairs or mayors in local governments. Basically, Nepal is a new federal country, and a lot of federalization laws have been still not actually enacted. The provincial governments and local governments have not enacted sufficient laws and institutional mechanisms. However, we have, after the new constitution was promulgated in 2015, we have Disaster Risk Reduction Management Act, which has federalized, pretty much federalized response to natural and non-natural disasters. And we have institutional mechanisms from federal level to the local level to work in disaster management, but this was not used by the federal government. Instead, federal government used age-old legal instruments such as Infectious Disease Act and Local Administration Act that they were enacted long ago, 60 years ago, and used these laws to issue lockdown orders and implement the lockdown orders through, federal police, because our provinces have not yet formed their provincial police. That's why to implement lockdown, the Nepal police Nepal police and armed police have been utilized. So this is pretty much, as I said, a nationally led response. At the beginning, as you know, that we have over 1,750 kilometer open border with India. Initially, and a lot of Nepalese work in India and a lot of Indians work in Nepal. We don't need visa to cross the border. So mostly, initially, we got a lot of infections in the border areas because a lot of Nepalese working in India started coming back to Nepal. And they brought the infection in initial days. And because the border management is done by armed police force, so there was no other effective mechanism to implement this. So federal government used this nationally led response approach. So it doesn't mean that the federal government, provincial governments and local governments have not been doing anything. In 2015, April, we had a huge, massive earthquake. And at that time, there were no elected local and regional governments. So this response to earthquake was pretty sort of mess. But compared to that, that experience, the COVID-19 response has been pretty effective comparatively, as I said, because there are local governments and provincial governments are in place, and they have been doing a lot of hard work in supporting the federal government in response to COVID-19. Although they have been doing whatever the federal government has delegated them to do, they have been effective in, especially the positive of this response is, the provincial and local governments have realized their roles and responsibilities. Especially local governments have been very effective in managing the quarantines because, as I said, most of the people, hundreds of thousands of people have returned back from India and they have to be put in quarantine. They have to be provided food and other logistics. And then the local governments have been very, very effective in doing so. And with that, the local governments have established their importance to, because they are the closest to the people. The people have realized the importance of local and provincial governments. And basically, in Nepal, federalism is not a very popular idea. Federalism was adopted because of unavoidable political pressure by the dominant parties. Federal government, the people in federal government or national politicians are not very, fond of this federal idea. But this COVID-19, because the role the provincial governments and local governments have been playing, we have, first time we have heard these national leaders, praising, appreciating, acknowledging the federal system. So this is, this has established, this COVID-19 pandemic has established federalism as a good, as a good idea in the federal level, and in the provincial and local level, people have realized the importance of, government being close to them. So these are the positives. In the negative side, if the government had utilized this federalized law of responding to the disaster, it would have been better. But because the provincial and local mechanisms have not been established yet, the federal government did not have much faith, much trust in this newly established government. That's why it didn't use the federalized law. But in the later phase, the federal government has given the local government and provincial government to impose localized lockdown and prohibitory orders. So the local governments have been now using this localized prohibitory order. Otherwise, for 4 months from late March to late July, we had over 130 days nationwide lockdown, even in the places where COVID-19 was not present, they were locked down. But now, in the later part, after August, the federal government gave the power to authorize local government and provincial government to use this. But from today, we are off the prohibitory orders. Now, the lockdown has been lifted with certain restrictions. So this is overall the picture. If you see the numbers, we have over 58,000 cases with 16,000 active cases. Relatively, the number of deaths compared to other countries is relatively low. We have so far 379 deaths. So a new federal country, having open border of 1,750 kilometers, India being really one of the worst hit countries. So we have so far, relatively less number of cases, which shows that it was the federal government, although not very well prepared, the response is more or less effective. So I would stop here.
Thanks, Kureshi. And it's, of course, joining us from the IDEA office in Nepal. I mean, it's a very interesting paper, and at least one thing that really struck out to me is how, in some cases, the pandemic can actually increase the kind of values of multi-level government, or particularly federalism, in places and parts of the world where federalism is not viewed with particularly well. And I think that's an interesting parallel with Australia. Australians often don't think of the importance of federalism or state governments, but I think in some cases we've seen, in some parts of Australia at least, that people are starting to realize actually that that federal government, or the federalism actually is a good system. And it sounds like Nepal has a really interesting parallel with that as well. That's great. So now we're going to turn to look at India and Ramdas Menon, who's an independent scholar who has a doctoral degree in sociology as well as diploma in public health, which I think is very helpful to take us through this. Ramdas Menon will take us through what's happening in India with respect to multi-level government and the coronavirus.
Thank you, Will. My takeaways are going to be based on the bullets I had at the end of my written piece. So basically, I want to make 3 points. The first thing to keep in mind is that India is a remarkably diverse country. So any average which is thrown out there, a number, an average, is meaningless, because if you dig a little deeper, you find a huge variation across the regions, across states. So that's something to keep in mind. The second part you got to keep in mind about that average factor is that right now, India has got 90,000 new cases. It's averaging 90,000 new cases per day and about 1,000 deaths daily. Fortunately, India is a young population, so the people are not dying at a high rate. But if you look at age-adjusted deaths, then you find that there are comparable numbers between, say, a country like Italy, Spain, and India. Now, obviously, July and August were really bad months when the numbers really started climbing. That was when the Indian political system underwent what they call an unlock after the period of the lockdown. So essentially, it's only now that the central government, which is coordinating all these activities, is beginning to take a look at the touch points between the state, the central level and the state level. And I saw some preliminary evaluations, and if I read them out to you, you're probably wondering, why are these things now coming to the fore 6 months into the pandemic? So basically, the evaluation suggests that there was misdirected communications, lack of training, lack of local empowerment, and inadequate resources. So at least they're trying to get a fix on these issues so as to improve the coordination between the center and the states and the local governments. The second point I want to make is that India is a parliamentary democracy where currently there's a single party which is dominant, which is the BJP party. So amongst India's states, 8 or 9 of them have opposition parties in charge. So there's a degree of partisanship already built into the system. So political tensions are inevitable. The key issue to keep in mind is where India's economy is at this point in time. In the 2 years preceding the pandemic, India's economic growth had actually slowed. Now, what's happened during the pandemic has been disastrous. There's been a 24% decrease in the GDP in just the first quarter of 2020. So fiscal issues have come to the fore. Another interesting development was about 2 years ago, all the states ceded some powers of taxation to the central government. And the central government implemented something known as a GST, which is a general sales tax, which they would actually collect and then distribute to the states. That process of transfers has basically stopped because of a lack of revenue and other reasons. So essentially now the states are running out of money. The numbers are climbing and you don't know what to expect right now. So essentially, the basic point I want to make is that there has been a trend towards greater centralization in India over the last several decades. But this particular pandemic is actually brought into focus because the way the GST has been implemented and the way things are being controlled, it might end up with a situation where the central government may have veto powers over the fiscal arrangements at the state level, which is against the spirit of any kind of federal system. So that's something that is evolving and is a matter of concern to a lot of politicians and others in India. The third point I want to make is that this is related to the issue of centralization in the Indian political system. You have what's happening is there's been a diminished level of accountability by the other institutions within a democratic system. And I'd call it diminished as opposed to an elimination of accountability. So the executive actions are very rarely overseen because basically the executive branch of government draws its members and support from the legislative branch, especially in a dominant party system. So if you look at Parliament adjourned literally around March 18th and 19th of 2020. There was a meeting of the Prime Minister and all the chief ministers of different states, maybe a couple of days after that. And I have gone back and looked at the data and evidence and articles, and I've seen no reference to an impending lockdown. So the lockdown was pretty much came out of the blue, where the central government really didn't share that information with the states and other entities. So what do you have? You had chaos, and I think a lot of it hit the headlines. So that's something to keep in mind. The other thing so the degree of consultation was lacking. That's the point I'm trying to make. The second point I wanted to make was that Parliament itself has been relatively inactive because of the lockdown conditions. Parliamentary oversight committees have not been playing a major role. Parliament has begun meetings this week. They started 2 days ago. And hopefully they'll start taking a look at some of the actions, especially on the fiscal front, where the money is coming from, whether the previous budget covered these expenses. So I'm not 100% sure what's going to unfold because it's a single party dominant system. But there are some signs which are a little unnerving. For example, the traditional question hour during parliamentary sessions has now been removed. So you're not encouraging the opposition to ask too many questions, that sort of thing. The other institution which I'm also concerned about is the courts. The courts have basically curtailed a lot of the activities. It's only as of September 1 that the courts have actually issued protocols for operating courts. I mean, how things are going to operate under the conditions of the lockdown or during the unlock period. So, and of particular importance is the high courts, the higher level courts where constitutional matters come to the fore. And you've seen some cases filed, but nothing has been heard. I haven't heard any arguments or anything of that sort. But there are some matters of concern which need to be addressed by the courts, such as India's moved to an unlock period. So what's happening is a lot of regions and cities and states have started implementing smart lockdowns. And they're relying on legislative power based on legislation which was brought up 120 to 130 years ago. So are these things still constitutional? And these were passed for different reasons, not necessarily related to public health. Another issue that is of concern is, about people's mobility restriction. How do you stop people from moving across state boundaries when you don't have, how can a state enforce those kind of restrictions when they do not appear to have the legislative authority to do that? So those are the issues which need to be addressed by the courts. And hopefully at some point, going forward, the legality of these matters would be addressed. But I'm hopeful for that. So I'm arguing that in the aftermath of a pandemic, there should be a constructive evaluation of some of these matters which are being discussed here. How these matters are resolved remains to be seen. India is India, so let's see how it goes. Thank you.
And thanks, Ramdas. Very interesting, and particularly interesting to think about. And another theme that comes out of your paper that I think you spoke a little bit about is the role of fiscal federalism, or the relationship between multi-level governments and where the money is a very important aspect of this, as well as it's very clear that the response to the pandemic is costing lots and lots of money, and the government is needing to subsidize people who are no longer able to work and so forth. So where is the money coming from is an important aspect of this. And so we're now going to turn to Pakistan and to Yasser, who's a postdoctoral fellow at Trinity, and he's going to tell us about some of the interesting ways in which the Pakistani government and multi-level government has interacted with the coronavirus in Pakistan. Turn it over to you.
Great. Thank you so much for having me here. It's great to be part of this panel. And just to talk about Pakistan. So Pakistan's an interesting case, right? Right now, it's sort of the case of, in many ways, the mysterious disappearance of COVID, because cases in Pakistan spiked in June and July and surged over the course of the summer. And then in August, the numbers started dropping sharply. And now I think there's some indication that numbers are starting to rise again, but there's no real explanation for why the numbers dropped the way they did. And frankly, I don't have an answer for you either, because it's really hard to see what the government really, or the state really did right to explain the success, as it were. Because Pakistan is a case study, I think, in how a contested constitutional distribution of power and bitter political rivalries can significantly actually undermine efforts to develop a coordinated response. So just to give some background, Pakistan is a federation comprised of 4 provinces. And through most of its history, the military has dominated Pakistan's politics and ensured dominance of the central government over the provinces. But in 2009, the parliament passed the 18th constitutional amendment that turned several previously federal subjects of governance into provincial subjects, including, most critically, healthcare, and expanded the policy-making and financial autonomy of the provinces. However, political rivalries have been mapped onto this structure, which has undermined the effective functioning of the federation, particularly which became apparent during the response to COVID. So since 2018, Pakistan has been ruled by the Tehreek-e-Insaf, which is led by Prime Minister Imran Khan. And Imran Khan's government, under this government, the military has been playing an increasingly significant role in governance once again, leading scholars to label the current political structure sort of like a civil-military hybrid regime. And the military has always steadfastly opposed the decentralization of power to the provinces. And so within the provincial governments, the PTI rules 3 of the provincial governments, that's the federal party. However, the province of Sindh, which includes the country's largest city and most hard hit by COVID city, Karachi, has been ruled by the opposition party, the PPP. And what's happened is since PTI came to power, its relations with opposition parties has been particularly strained, as it has gone after opposition leaders, arrested them, detained them on corruption charges, etc. Right? So when the pandemic hit, so that's kind of the situation into which Corona entered, and the pandemic hit. And when the pandemic hit, the federal government initially wanted to avoid a countrywide lockdown. And the Prime Minister publicly played down the threat from the virus, compared it to a flu, etc. And always voiced concern about the economic hardships the lockdown would create for the poor, which is the valid point. But provincial governments, which sort of had the public health portfolio, moved to impose lockdowns within the provinces. And so the federal government reluctantly finally agreed to a national lockdown in late March, right? And the government did, to its credit, make some efforts initially to provide economic relief to those most affected by the lockdown, although a more expansive and sustained policy was required. But the government's policy then soon switched to resuming business activity and ending the lockdown as quickly as possible. And that became the government's priority. And in mid-April, first, the government decided to reopen mosques for communal prayers and reopen certain industries. And then by 9th May, it said the lockdown is over and all markets must open, all restrictions must be removed, and provincial governments must comply, right? Now, the federal government tried to do this through, could have done this through sort of inter-provincial coordination and deliberative bodies, but instead it convened a national coordination committee and a national command and operations center to handle the emergency. And in these institutions, the provincial ministers were outnumbered by federal ministers and military officers. And the whole structure was designed to privilege the federal government, especially the military, over the provincial governments. And this had two important consequences, and lasting ones, potentially. First, it furthered the involvement of the military leadership in governing the country, further reversing the limited gains that had been made in democratizing the country since 2008. You have military officers now serving across the NCC, the NCOC, and all kinds of department, disaster management and health authorities at the federal level. Second, it led to increased friction between the center and the provinces, right? So you have the federal government first decided to lift the lockdown, and all the provinces, actually, including the ones run by the PTI, warning against doing this, right? The provinces, concerned primarily with public health, were pushing for more lockdown measures, more testing, more treatment facilities, etc. But the federal government was able to, impose their will. The governments loyal to the PTI fell in line in the provinces, but the PPP federal government in Sindh protested the federal government's actions. And over the course of the summer, tensions grew, right, between the federal government and the Sindh government. As each government would call each other out, the federal government would claim that the Sindh government is creating a panic. The Sindh government would claim the federal government was sabotaging their response, and so on and so forth. And into this, then the Supreme Court intervened, another federal institution, right? And they intervened in favor of the federal government, ordering the lifting of any remaining lockdown restrictions and pushing the Sindh government to comply with the edicts of the federal government on this issue. So by mid-May, the country was effectively reopened just in time for the religious festival of Eid. People flocked to markets, flocked to religious gatherings, and the result was a surge in cases and deaths. And by the first week of June, the test positivity rate was 23%, and hospitals reached capacity, and the country was simply not prepared for the surge of cases it saw. So then the central government switched tact, right? It moved to what it called a smart lockdown policy, which we heard about a little earlier as well. And these were limited lockdowns applied only to specific localities within cities or rural districts. Now, one advantage of this was that it actually gave provincial governments and disaster management authorities a little more discretion, because they could allow them to target hotspots and enforce lockdowns without appearing to defy the federal government's opposition to a national lockdown. But it was always a handicap policy because Pakistan always had very limited testing and tracing capacity to really meaningfully, find and target hotspots proactively. So as I said, there's really not much to explain why cases went down, right, in this situation. But what also we see in terms of the effects that this had, the federal government seems to have learned the wrong lessons from this experience. The Prime Minister stated in June that the 18th Amendment, that decentralized power has to be reviewed and centralized more power given to the Federation. The military has opposed the 18th Amendment, and the Supreme Court has also intervened to tip the constitutional balance in favor of the federal government in the name of uniformity and coordination, right? And this is problematic because on balance, it seems that when and where the provinces were given more discretion, the state proved more adept in responding to the pandemic, simply because they were operationally less distant from the affected communities. In fact, it would have been even better if local governments, municipal authorities had been given more power and discretion, but the local government level of Pakistan's system has been largely disempowered in the last few years. And what we also learned from this is that a coordinated response requires building a political consensus. You see, in a multi-level system with multiple political parties, it is almost impossible to unilaterally impose a pandemic policy because it is unlikely that one political party will monopolize political authority at all tiers of government. So there's going to be pushback. And this is especially the case when you're not using the language of an emergency to compel deference because you're actually playing down the extent of the emergency, right? So in a diverse multi-level federation like Pakistan, the best approach would have been one that gave provincial authorities more discretion and flexibility and built consensus. But that's unfortunately not where the Pakistani system is heading and not the lesson that seems to have been learned. Thank you.
Thanks, Yasser. Again, very interesting. I mean, a key kind of interesting thing that comes out of that, we generally haven't seen courts playing particularly big roles in COVID responses, but here, obviously, the intervention of the Supreme Court is very interesting. And it sounds like the story you're telling is that this was seen as it's a federal move to centralize, and the court's playing a role in that. And also, I mean, the role of the military in multi-level government is also a fascinating one, the extent to which the military is a centralized institution that is going to reinforce centralization as opposed to the dispersion of power. Okay, so now we're going to turn to the discussion section of our discussion. So I ask you guys to raise your hands in the panelist participants section. So just hit the raise hand button there, and I'll just go down the list there. Or you can turn on your video and just wave at me. While you're doing that, and while I'm taking a list, we actually have a couple questions, one for Ramdas and one for Anne, which deals with local governments. So Ramdas, a question for you: how far were local governments involved in preventing? So what role did local governments play in the Indian response? And for Anne, a question, a quite specific one, with respect to that the president of the local government Australia was on COAG but excluded from the national cabinet. Why do you think that's the case? And do you think this has affected any COVID responses at all? So let's start with answering those questions, and raise your hand, and I'll start taking a list from there. Thanks, guys.
Generally, when you look at the public health literature, in dealing with health crisis, local empowerment is one of these models which basically results in good successes. That's the way we would argue from a traditional public health perspective. But then these countries and in India, whatever, all the other countries, the way the legislation, the constitution, everything is written is pretty murky. I mean, they are allowed certain responsibilities, but at the same time, they're not given the right to allocate, to gather, harness resources, taxation rights, and all those kind of things. They are lacking in those kind of means to actually build up a good infrastructure to deal with health crisis. The model I would look at is what's going on in what went on in Mumbai over the last several months, where at the municipal level had played a key role in tackling the infections in the greater Mumbai area. And I think given the level of congestion, the population, the poverty, and all those issues, I think that entity, which is known as the BMC, did a pretty remarkable job. They had a lot of assistance from the state. They had a lot of assistance from the feds or the center. But I think they provided a lot of the grassroots workers and strategies to go out there and confront the infections. And they knew the population. That was the main advantage. They knew the population. So they were able to achieve a certain degree of success. I just read that the infections are creeping up again, but I'm fairly sure they've got the resource to keep it under control. The unique thing about Mumbai is it's very unusual by any other Indian standards. They have the capacity to, they manage hospitals. They have clinics. They are allowed to recruit workers. I think they have certain rights where they can garner taxes and get taxes to pay for these things. So Mumbai is a very unique situation. And the success of Mumbai would basically arguably be a case to look at and maybe replicate in other parts of India or wherever this infection's occurring.
Thanks, Ramdas. Over to you, Anne.
Okay, I was just having a tiny little look on my screen there about what sort of responses have come from local government. Yes, local government did get kicked out. It had always been represented on COAG and it isn't on the National Cabinet, which leads to the question of why. No one's ever said why, and my suspicion, Cheryl might have another view on this, but my suspicion is that it's largely about not being in the club. So I think that they took the view that they could keep things confidential in this new idea of a national cabinet, which was supposed to operate along similar lines to collective cabinet responsibility, if it was just the leaders of the various states and territories and the Prime Minister once you bring in a person who's president of the Australian Local Government Association, they're a bit of an outsider from the club. They're not someone that's at that level of responsibility, and they're more likely to go out and tell their members things that happened because they're responsible to local government. I think that the reason that the Commonwealth excluded them from the National Cabinet was to keep a closer control on what had been said in National Cabinet, secrecy of documents, etc., not revealing them to local government. I mean, I may be wrong, but that's just my guess as to why it happened. Local government has objected loudly, but no one's been paying it any attention, frankly. And having said that, I also think it hasn't been playing a huge role in relation to the pandemic response. Mainly its role has been reactive, so in terms of just implementing things that others have imposed, but it's not really been proactive. We don't have the same decentralisation of health down to the local level that you see in many jurisdictions, and I think that's made a difference too. Thanks.
Okay, I think we have a few other questions on local, so I might bring in Budhi and Yasser on this. So Yasser, is a specific question for you on the extent to which the absence of elected representatives at the local level, whether that had an effect on the effectiveness of the response to Pakistan.
It's a good question, and I definitely think it did, right? Because essentially what you have when you just have like local levels bureaucrats involved at the local level in sort of system of government, they're merely implementers of whatever is being decided or determined at the federal and provincial level in terms of what needs to be done. And I think having elected representatives with some kind of involvement in crafting and shaping policy regarding how communities should be targeted, resources, healthcare resources should be distributed, relief packages should be given in communities, would have created a more responsive approach, would have been better at targeting hotspots and figuring out how different communities are more or less or better or worse affected by the different policies being produced by the government. And that kind of discretion at that level, I think, would have allowed for a more well-honed and well-targeted kind of response, which I think was clearly missing in Pakistan, with decisions being made at an increasingly centralized level by the NCOC, as it were. Yeah.
Budhi, do you want to come in on local government in the Nepali context?
Yeah, I mean, earlier, as I said, compared to the 2015 earthquake, when local bodies were run by bureaucrats, local governments have been blessing in time of this COVID-19. As I earlier said, basically our response is centralized. Local governments have been doing whatever they are asked to do, and they have been provided the resources from the federal government. Local governments have been relatively, I would say, successful in managing quarantines. People coming from outside, outside their local government and outside the country. In the earlier phase, local governments were very instrumental in distributing reliefs to those who are needy people. And right now, because as Nepal is new federal country, and we have 3-year-old local governments and provincial governments. Now the federal government has been funding to establish at least 5-bed hospitals in every local government, which is a good sign because many of our local governments do not have basic health infrastructure. So I would say, rather than provincial governments, because provincial governments do not have not been very clear about their roles. If you see the constitutionally distributed state powers, provincial government's role is not very clear, especially in a situation like this, whereas local government's role is much more clearer than provincial government. And because local governments, we have a little experience of local governance, even in the centralized unitary system before. Local governments are clear because their role is to manage quarantine and to help trace the contact tracing and all this. So by and large, local governments are more working more effectively than provincial government in this current COVID response.
Great. Well, this is a fascinating issue, and one that I can just briefly reflect on in the American context. In the United States, it's a huge issue between states and particularly city governments, local city mayors and so forth are often at odds with each other with respect to the response, as the federal government's doing very little, and the states and the cities are then often at odds over how to respond. So we do see actually even conflict at least in the U.S. constitutional system between the states trying to tell the cities what to do, yet, or in other cases not trying to tell them what to do, and seeing real patchwork across different approaches. Now, I want to raise, so if anyone wants to at this point jump in with questions, raise your hand. Cheryl?
Yeah, can I just ask one general question of the panelists and make a brief observation about local government in Australia to respond to Anne's encouragement? The general question is, just sort of listening to you all, the federal system seems to have come into its own a bit in each of these countries, in the sense that subnational government, at least, and in some cases local government, has been seen to have important roles to play. And I just wonder if you think that that's changed the attitude of people in general towards the way in which multi-level government works in these countries, and whether you think it might have any longer effects. But if I can just briefly say something about the National Cabinet and local governments in Australia. I mean, Anne's absolutely right. There seems to be some desire to maintain the confidentiality of National Cabinet, which I'm sure will blow up in everybody's faces sooner or later. I'm not quite sure whose idea it even was, or how it could possibly be thought that it was going to work. But I wonder whether the exclusion from the National Cabinet of the one person who represents the whole of local government around Australia really was because everyone around the table had a really big job to do in a crisis, whereas the head of ALGA wouldn't necessarily. That would involve getting a message out to all the umpty two local government units around the country, and it was just a different position for the purpose of this crisis moment. So that's a more positive way of looking at the decision, perhaps.
And Cheryl, are there any members of the panel in particular who you want to direct your question on local government to?
Look, and it's not urgent for people to answer it now. If you want to just keep it until the closing remarks, that's fine as well.
Yeah, let's collect some questions. I see Anna's got her hand raised, so we'll hand it over to Anna.
Hi, thanks, Will. Thank you, everyone, for your presentations. I just had a thought and wanted to circle back to something that we talked about in the first webinar, which was about the decision whether or not to declare a state of emergency. So I noticed that in Budhi's paper on Nepal, that option was there. There's an option that a province can request the centre to declare a state of emergency, but it wasn't used. And I wondered whether that came up at all in other federal systems, and if so, whether that then is a question of intergovernmental relations. Is there some sort of requirement to consult states or to trigger a state of emergency that involves all of the levels of government or not?
Great. So let's. I think we'll take that one, and I might hand it over to Budhi first to reflect on why that was. Is this a reflection of what you were arguing, that actually there's some value, that they started to value local initiative and local government? Or why didn't they call a state of emergency? And then ask anyone else in the panel if they want to jump in on this question as well. So start with you, Budhi.
Yeah, it's difficult to say why state of emergency was not declared, because Constitution clearly give, this pandemic is one of the grounds the state can declare a state of emergency, and the provinces can ask the federal government to declare state of emergency. But the provision is, within 1 month of declaration of state of emergency, that has to go to the parliament, and the parliament has to endorse it by 2/3 majority to extend it for 3 more months. So, and once the government, actually the cabinet discussed about this option, and there were rumors that the cabinet recommended it to the president, but it never came. So I guess because the parliament is not in session and it is difficult to call the parliament in time of pandemic, and then mobilization of Nepal army might have been issues. So it was not actually used. This option was not used, and no province has thought about asking the federal government to use this. That out of 7 provinces, some provinces are really badly hit by COVID. Some provinces have been effective in implementing the federal orders. Some are not. Right now, the Bagmati province, where the capital lies, has been the worst hit. Province 2, which borders with India, for a long time it was the worst hit, but no province has thought about asking the federal government to impose, because there are several other repercussions. If you impose the state of emergency, some of the fundamental rights can be suspended, and that might happen in new federal structure. I think that was wise thought of the federal government and provincial government not to use this.
Great. Yeah, Anne, you want to jump in on this?
Yes, it's quite interesting in Australia actually, because at the national level, the Commonwealth doesn't have a general power to declare a state of emergency. We saw in the bushfire crisis earlier this year that the absence of a power to declare a state of emergency seemed to disturb the Prime Minister, and he went so far as to create a royal commission to be able to advise on whether or not the Commonwealth needed such a power. And I remember being asked about it at the time by the media, and I said, well, just declaring something an emergency doesn't actually do anything. I mean, it might be symbolic, and that issue has been raised in Victoria in relation to the bushfires there, but declaring the state of emergency has to trigger some kind of powers that you have to exercise in those circumstances. And in Australia, mostly emergency powers are things that are held by the states. And so there are real problems about the Commonwealth at the national level actually having substantive powers to deal with emergencies. You have to start looking at implied nationhood powers and things to get you that far. Each of the states has a power to declare an emergency, a state of emergency. It's all slightly different in each different jurisdiction. And I think nearly all the states did declare an emergency in relation to the pandemic, except interestingly New South Wales, which is where I am at the moment. And the reason they didn't is because they didn't need to be able to trigger their legislation. The point of declaring a state of emergency is simply to trigger certain powers in your legislation. And if you look at Victoria, for example, they not only have a state of emergency, but a state of disaster. So you can have an emergency and a disaster at the same time, which is what Victoria has. And they trigger 2 different sets of powers. So the state of emergency, surprisingly, triggers the health emergency powers, whereas the state of disaster triggers more police type powers and powers to control the public service, etc. And so there's a bit of confusion by the fact that Victoria has 2 things and everybody else only has 1 thing, and the Commonwealth doesn't have anything at all, except that under its Biosecurity Act, it does have a power to declare something to be a pandemic or whatever, which does also trigger some health powers that the minister holds because of the quarantine power that the Commonwealth has. So in Australia, vastly complex, very messy, but in the end, the key question is, what does your declaration actually trigger in terms of powers that people can exercise? Because that's the key thing.
And I just want to give Ramdas or Yasser any really interesting or just quickly anything on the emergency powers that were important in India or Pakistan?
I think there were other pieces of legislation which worked to achieve the same goals. So there wasn't an effort to trigger emergency kind of legislation. And the word emergency in India has a certain negative connotation given certain events over 30, 40 years, maybe almost 50 years ago. So I think the prudent course was to find ways to exercise power using other forms of legislation.
Yasser, any?
Yeah, I mean, just briefly, I think on the question of emergency powers, the provinces in Pakistan did declare emergencies, and essentially what emergencies allow is giving some authority to provincial disaster management authorities to, shut down certain businesses, manage certain affairs, and urgently direct relief, right? So there was those provincial emergencies declared. However, the idea of a broader national emergency is always more contentious because emergencies that have previously been declared in Pakistan have been used as sort of pretext for essentially dissolving provincial governments, taking federal power, and aggrandizing federal authority. So a national emergency is always something treated with more suspicion and historical skepticism because of Pakistan's unique sort of history of civil military turmoil. But there were provincial emergencies declared, of course, and I think this is the important part. What the provinces could do under those emergency powers was a contested question through these months, right? So when the provincial government said, as part of our emergency powers, we would create economic relief packages, the federal government said, no, economic relief is a federal subject, right? And they'll say, so don't provide economic relief. So so you had these like back and forth during this period about what the provincial governments could and could not do as part of its emergency powers and disaster management authority as well. So yeah, so it was an interesting question in that sense, yeah.
Right, very interesting. Well, now the questions are flying in fast and furious. So I'll take two questions actually. So I'll start with Amanda and then go to Rohan. So Amanda first, please.
Thank you, Will. If you don't mind, I have two questions, but the first is more of a question for comment. I'm just struck by the intersection of the multi-party and multi-level systems in all these case studies, and we spent a lot of time in the last session speaking about the role of the opposition and sort of making sure the ruling government party isn't operating with a blank check to do whatever they'd like in response to an emergency. So I'm just interested, especially in Pakistan and Australia, and you mentioned that with the oncoming elections, more partisanship is emerging. So just what is the sort of relationship between multi-level and multi-party systems and the role that these things play? My second question is on data sharing. I was struck that in the India case study, Ramdas mentioned that there's been some questions about how much the state governments can access the data that's being collected by the national government in apps versus what Anne said about the Australian government really being able to operate off of a shared evidence base and expert opinion to address the pandemic. So in a multi-level system, I'm just curious about some of the issues around data sharing between levels of government. Thank you.
Thanks, Amanda. Rohan, go to you.
Thank you. I have a question really for Budhi and Cheryl. Budhi, you said that the federal system in Nepal worked, but partly because the second and third tiers of government basically did what the first tier wanted them to do. Yeah. And I was just wondering whether that then could be interpreted as a success story for federalism, because in a sense, that's not what federalism is all about. The second and third tiers doing what the first tier directs them to do. And I was wondering, Budhi, I mean, in our part of the world, in Nepal, Sri Lanka, selling local government has never been a problem, right? The challenge for federalism has been to sell the idea of a second tier. And so when viewed from that perspective, I wonder whether you can say that the COVID-19 crisis has actually been a success story from a federal perspective. It has been a success story in terms of showing how local government engages in effective service delivery, but it hasn't really provided a justification for federalism in a comprehensive sense, including the role of the second tier government. And I was wondering whether you'd like to respond to that. Thank you.
Thanks, Rohan. Well, I'm going to put that provocative question straight to you, Budhi, and to see how you respond.
Thank you, Rohan. This is really a very sort of, we could discuss, longer. But to be precise, as I said earlier, this is why I said, this has been successful is purely on COVID response. If provincial and local governments were not in place, our COVID response would have been a sort of disaster, okay? What role it will play in the success or failure of federalization process or federalism, you know, in Nepal, this is new, and we have to find happiness in these smaller things. As I earlier said, federalism is not a popular idea among a large section of society and political actors. You know, this has given them to think that actually it's not a bad idea. So our prime minister, our presidents repeatedly, you know, after this only, we never heard it before, repeatedly in parliament and addressing people, addressing media, they have been saying that federalism has been very effective. Local governments have been effective, provincial government are very effective. And for me, as a student of you know, federalization process in Nepal, these are big takeaways for me. For provincial and local governments, because they are only less than 3 years old, you know, this has given them to seriously think about their roles and responsibilities. If this COVID response was federalized, as I earlier said, if Disaster Risk Reduction Management Act had been invoked to respond to COVID, we would have actually measured how much provinces and local governments have done. This is federally led, centrally led response. We have to see, you know, whether the provincial governments and local governments were able to do whatever they were asked to do. That's what I would say, okay? So for me, I would have been really, I mean, I would have recommended, suggested using the new federal law to respond to the disaster, this pandemic. But the federal government didn't use that. Federal government used Infectious Disease Act, in fact, where the provincial and local governments have very limited thing to do, right? That's why I said, particularly in response to COVID-19, the local and provincial governments have been very, very useful. And they have been able to just realize their roles and responsibilities.
Right, Budhi. Well, working back, would like to go to Ramdas now to Amanda's question about data sharing, the extent to which there was data sharing across the different levels and how that might have helped the effectiveness of the response in India.
Keep in mind there is data sharing, but there are also issues related to data standardizations, the way they collect it. For example, COVID-related deaths are reported differently across different states in India. And this, although there are guidelines from the center, the guidelines are interpreted differently by state level health departments. The biggest thing that the center launched was an app which was downloaded into smartphones and could be used for a variety of surveillance activities. I haven't seen any use of that data and I don't know why. I suspect it has to do with the fact that it's very easy to create an app. But then once you create the app, you need data governance rules. You need people who are trained to be able to use it. So the fundamental issues at the ground level, where the touch points between the center and the states occur, people are wrestling with issues such as, well, we have material which has been given to us in Hindi or English. We don't have the resources to translate them into regional languages, right? So so you're dealing with some basic fundamental infrastructure issues to leap forward and say, yeah, we have all this data, now go ahead and use it, when they don't have the capacity to even understand and use this data is a bit of a stretch, I think. Over time, yes, the capacity is going to be built up, but right now, no. I do know that some of the cell phone data has been used for investigative purposes. When someone is being interviewed about contact tracing and that the answers are evasive, I've heard of cases where they actually get the phone and find out where this person has been. So on a mass public level, I don't think it's happened yet.
Thanks, Ramdas. The Australian experience has been our COVID-19 app hasn't been particularly successful, the one issued by the federal government. I want to turn now to the question that Amanda had, a general question Amanda had, and hand it over to Anne, because I think this is really interesting. This intersects with a lot of the discussions we're having in the second webinar, which is what's the relationship between multi-level government and partisanship? And is it a good thing, bad thing? Is this deliberation, or is this just blaming, or blame shifting and so forth? To talk us a little bit through this, and particularly the role, as Anne mentioned, of these state elections. I mean, the one upcoming in Queensland. What's your take on how this multi-level kind of partisanship is playing out, and is it having positive or negative effects?
Sure. The one thing to understand is that the political parties in Australia are the same parties at the federal level and the state level. And so if you're a federal prime minister who comes from a coalition of the Liberal Party and the National Party, you're concerned about how the Liberal and the National Party will do in other jurisdictions in various states. That actually plays a big role. If they were separate parties, as they are in some other countries, then that would make a difference. So we've seen some quite interesting things come out of that recently. So if you look at the criticism that the Prime Minister is expressing in relation to closed borders, he's very critical of Labor governments that have closed their borders. So the Queensland government and previously the Western Australian government for closed borders. But at the same time, he supported the New South Wales government when it did close its borders to Victoria, because the New South Wales government happened to be a Liberal government, so from his neck of the woods. And that leads to sort of, difficult political issues. I think the most interesting thing, however, has been the treatment of Western Australia. So originally, Western Australia was pilloried by the Commonwealth government for shutting its border. Western Australia defended shutting its border because it means there are actually no COVID-19 cases there and haven't been for something like 150 days. And because of that, they can open up their economy there, and in particular do mining and the sorts of things that are really important financially to Australia. And they can do things without the kind of restrictions we see in other jurisdictions where you've got to have, social distancing and all those sorts of rules. In Western Australia, you don't need those same rules because there just is no COVID-19 with the borders shut. Now, initially, the Commonwealth said, no, you've at least got to open up those borders to other states where there's low or negligible amounts of COVID-19, like South Australia, Tasmania, etc. And when a multimillionaire challenged those borders in the High Court, saying that closure of the borders was unconstitutional, the Commonwealth intervened on behalf of the multimillionaire attacking it. What happened then politically was really interesting, and that was that the people of Western Australia really strongly supported the Labor state premier in keeping those borders shut. And the pressure, the political pressure of that was so strong on the local Liberal Party that knew it was going to get slaughtered at the next election because of this, that the federal government changed its tune. It's now being very cooperative towards Western Australia. It pulled out of the litigation. It says it's no longer arguing against the closure of the border with Western Australia, etc., etc. So there's been a huge change there, even though they are opposing governments, a Labor government in Western Australia and a Liberal national government at the federal level, because it's got to the point where the politics are such that it's too poisonous for the Liberal national government to be seen to be opposing this policy in Western Australia, because they will A, lose seats at the state election over it, and B, probably lose seats there at the federal election over it as well. So that's changed the politics enormously.
Thanks, Anne. I want to throw it quickly to Yasser as well, because I mean, Yasser tells a very kind of negative story about how partisanship plays a role in essentially the relationship between the center and the provinces in Pakistan. So, Yasser, did we lose Yasser again?
Can you hear me?
Oh yeah, you're here. Great, yeah. Over to you.
Yeah, I would call it, I guess I would characterize it slightly differently. I think the negative story is because the federal government and the party at the national level chose to approach the opposition parties in the way that it did, right? And I think I think because in a multi-level federation like Pakistan, like India, like these countries, you will have opposition parties have some level of policy making control at some tier of government, right? And where that is the case, the federal government and the party at the national level should be willing to work with or build some kind of consensus with those parties and carry them along in how to deal with the pandemic. But in Pakistan, that was just not the mode of operation, right? You see the party that's coming to power is sort of this premise on this idea that all the traditional parties that have ruled Pakistan historically are all bad, are all corrupt, are all entrenched dynastic elites. And so their purpose is to displace and remove the parties that are currently in the opposition. And therefore, there's been this push to sort of not negotiate, not accommodate, not bargain with other parties at all. And that's a choice that the National Party, the PTI, has made in how it chooses to approach not just COVID, but all other emergencies in the country, right? And all other issues in the country, right? Marginalize and vilify other political parties. And that's not a good recipe for coordination and consensus-based policymaking, right? And so, I mean, I think, whether partisanship is good or bad within a multi-level system depends on how powers are distributed within that system, right? Does the presence of multiple parties at different levels of government allow for some kind of checks and balances on an oversight, right? Okay, how does the federal government try to make policy or impose policy in the provinces? Is it imposing it in a way that's good for the provinces or not? And if not, is there a way for parties empowered at the provincial level to push back, to restrain, to bargain, to modify or improve those policies in how they're implemented over there, right? So if you have a system where multi-level government allows for different kinds of checks in the policy-making process, then I think partisanship works well in that system. Whereas in Pakistan, there seems to be this push not to work within the multi-level system, but to override it and to centralize over it. Then you'll have a lot more policy-making dysfunction and name calling, political mudslinging, which is what we saw happening in the Pakistani situation.
Yeah, and it does seem like it is obviously maybe part of the Pakistani story that the provincial powers is so new that it's potentially that it may not yet have been kind of concretized enough to really play a role in deliberation, which we might have seen, you see in other parts. I mean, I think to some extent the Australian story is one of partisanship actually playing some role in helping deliberation.
Yeah. And also just to add, it's also because I think even when it was new in 2010, the first 6-7 years, it moved, sort of the political reality of the country evolved very quickly to adapt to this provincial autonomy. But the government that's come in place in this new sort of structure since 2018 prioritizes rolling back what's happened, right? That's an important part of their platform. Hence, there's a concern, and COVID is only sort of, as in their head, sort of confirmed their worst fears about provincial autonomy. So there's even more of an effort to roll it back as much as they can, which is why it's a very contentious time in politics in Pakistan right now. Not that it always is, but
Very interesting. So questions keep coming in. A question from Philip Gonzalez from the Forum of Federations, and this brings up this theme we've been talking about a little bit already about local governments. And I want to bring in some new people here to talk about this, local or city governments. I mean, so we haven't talked much yet about cities, but of course cities are where the pandemic really generally is transmitted the most, and interesting to talk about cities. So I want to ask if anyone, who hasn't spoken yet, say maybe Benny or Kimitoshi from Japan, want to talk a little bit about how cities or local governments have worked in your jurisdiction?
Yeah, can I?
Yes, please do.
May I jump into your discussion? Thank you very much for the invitation to this seminar. And as I said in the first seminar, our government, national government, has a power to declare the state of emergency, while the law delegates the power to the municipal government to have the concrete measures to deal with the COVID-19 situation. So, city level, which government the most likely knows the situation is a city and world and area, because the number of the patients they know very well, and number of the doctors and medical service providers they know very well, so that they can coordinate to deal with a particular situation, their situation. Issue is the finance. The local government, particularly small government, village, city, that do not have enough money to deal with such a situation. So that they ask for the money from the national government, so that there is some heated discussion between the national government and the local government, particularly the small government, how to finance critical situation in each portion of the nation. So such a balance of the discussion. The measures are concrete in a local level, but finance should be provided by national government. That is a heated portion. But good thing is that the many city governors, mayors and governors show up on the TV. They announce the situation on each village, so that the many people in Japan have the knowledge about what happened in each city or village, so that some transparency of the information sharing among the people in Japan was created through such media appearance of the city governors. So that is Japan.
Thank you. Benny, would you like to contribute on the Philippines?
Yeah, thank you, Will. Mm-hmm. Can you hear me?
Yeah.
Yep. Okay. Yeah. So basically, I think it's the same experience all over with respect to local governments. I mean, that they're given mandate and they're expected to implement the policies of national government, especially with the Philippines. We are a very highly centralized country, but the resources remain with the national government. So that's why what happens is that only those well-endowed regions that have more resources coming from the share in national taxes, and these are usually local government units that already are developed, okay, and they have more resources and they are doing much better in terms of implementation. But those and the majority that really don't have the resources, okay, only have mandates and directives, no? but the facilities and the resources to implement these policies against COVID, tracing, etc., aren't there. No? So I think it's important. I think the lesson there is if you have a highly centralized system like the Philippines, then you need to look at the capacities of local government units also, and be able to structure the transfers, financial transfers, okay, according to the needs of these local government units. No? So that's the first point. No, I'll just take this opportunity to ask a question also. No? So it's a general question. You know that the Philippines is a unitary system, but there's this region in the southern Philippines where I am and where my institute is, and we're trying to make this federal-like relations with the national government now. But that is a very new region. We have the region has resources. I mean, because we have the from the national government, and we have the mandate also. No, so but of course the capacities are very low still. No, parliamentarians of these former rebels now running government. So it takes some time. So the mandate is there, the money is there, and this is, well, in a kind of a theoretical question to our panelists. If you are given, okay, a blank check, or you're given I give you this, this piece of paper now, where you're able to tell us what are the most important ingredients, okay, to make our relations with the national government work with respect to in addressing pandemics like COVID-19, what would you advise us? Okay, whether that's IGR, whether that's power, whether that's fiscal relations, etc. So that's a general question for the panelists. Thank you. Thank you, Will.
Thanks, Benny. So I'll collect a few more. I mean, we're starting to run out of time. Yeah. So collect a few more questions or comments from anyone, and then ask each panelist to kind of give their final words. Anyone else have? I've got a couple of things I'm going to say. Does anyone else have any comments or questions at this point?
I do have a comment, and you brought it up earlier. Follow the money. Check on where the money is coming from, how the allocations or how the financial arrangements are made. Because at the end of this pandemic, and I'm sure at some point the pandemic is going to be over, a lot of countries, a lot of states, a lot of regions are going to be in debt. And and this is on top of the existing debt. So we need to keep an eye on the financial and fiscal aspect of this pandemic.
Yeah, and we heard that in the Japanese context, and the extent to which the cities or the local governments don't have the money, but they have the responsibilities. A question or a comment, I guess, or that I would put to the panelists in their kind of final words is to say a little bit about the role of police in multi-level government. I mean, I know in the Australian context, police are largely it's state level, and that's it. But in other contexts, that it introduces a significant level of complexity because the police are at the city or local level. You have the state who have some police force, but sometimes not so much, and then you have a kind of federal that may or may not have a police force, but might have a military. So how has enforcement across the multi-level government with respect to police or military are kind of played out, and what role has that played? And that's something I'd be interested in hearing as well. And I'll make this opportunity, just one last opportunity for anyone else to jump in with question or comment to put, because I'm going to give the panelists one last few moments to speak, or a couple minutes to kind of conclude. Anyone else? Final question to put to the panelists at this point? Okay, so I'll go to we'll start with, let's go in the same order we did before. So we'll start with Anne. The two questions are Benny's question. If you had a blank check, how would you change, or what would you change? Talk a little bit about policing. Curiously, there's a bit of a thing in Victoria about what role the Australian Defence Force could have played in quarantine. Seems to be a bit of a political, more of a political thing than anything. And then also a little bit about the fiscal federalism relationship in Australia, how that's playing out as the federal government is footing the bill for a lot of those. States are paying some things, but a lot of the money is being provided by the federal government, and a lot of the implementation and enforcement and decision making is at the state level.
Okay. I think the issue about police and the army is really interesting in Australia. There's quite limited Commonwealth powers to allow the armed forces to provide civil aid. So I did a seminar on this for ANU quite recently, and we spent a whole hour talking about it. So if you know, in Victoria, for example, to the extent that the ADF, the Defence Force, is being used, it can only go out with police officers, because only the police officers have enforcement powers. The Defence Forces might be there to be helpful and fill out forms, but they can't actually arrest anyone, they can't detain anyone, they can't take any coercive action. Only the police can do that. And so that's made it quite difficult. I think the other really interesting thing that's come from it is, in our federal system, it's always been the Commonwealth that's been strong and the states that have been, overburdened by the Commonwealth. But what's been interesting in this crisis is that it actually has shown that the Commonwealth is quite impotent in many circumstances. They actually do rely on the states. The states actually do have substantial power, and a lot of people have learned this for the first time. So I think it has surprised people that the states actually do have substantial powers. And one of the reasons that the Commonwealth is so impotent is that it actually can't enforce or give effect to a lot of what it might otherwise do. So, for example, one of my colleagues put out an article saying that, well, the Commonwealth could use its biosecurity powers to legislate in relation to quarantine in such a way as to cover the field and exclude states, and therefore it could open up state borders, and it could have its own system where it put sort of rings around, or that kind of smart lockdown system. But the practical reality is that the Commonwealth just simply doesn't have the personnel to be able to implement it. I mean, it just doesn't have the people to do it. The armed forces don't have the power to do it. There's not enough of them to do it. And in the end, the Commonwealth relies on the states and their police forces and their personnel to do these things. And this has really been shown up in the latest pandemic. Yes, in the end, the feds are footing a bill. And in the past, they've used that to impose conditions on the states, but in these particular circumstances, they've not been able to exercise their powers as strongly as they have in ordinary circumstances. So I think that's been quite interesting too. Probably taken up all my time, so I'll just pass on there.
Great, thanks, Anne. It's an interesting parallel, at least with what's happening in the United States as well, in the sense that you see the extent to which the federal government in the United States similarly has not had a lot of ability. It's been largely a state and local response to the coronavirus pandemic there as well. Largely again because of the lack of enforcement power that the military might have, or the federal FBI might have, or so forth. Budhi, I want to turn to you now, and I'm very curious to hear in the Nepalese context the fiscal relationships in a developing, as you talked about, drawing a little bit on what Anne was talking about. Australians are realizing for the first time how much power their states have, and is there a similar story in I mean, you've talked a little bit about this in Nepal. But also, how is this affecting the fiscal relationships that are obviously going to play a big role going forward in the development of Nepalese multi-level federalism?
Thank you, Will. In the Nepali federal system, it's very centralized federal system, which is not very unusual because we come from a highly centralized unitary system to a centralized federal system. And actually, if you see the distribution of powers and distribution of taxing powers, it doesn't match. Taxing power is much, much more centralized than distribution of functions and other things. So, our provincial and local governments have very little taxing power. Mostly 5 major taxing areas come under federal government, and hardly 20% of revenue taxes can be generated from provincial and local governments. So, which means that the provincial governments and local governments very much depend on federal government on finances. Constitution gives a formula, and we have National Natural Resource and Fiscal Commission, which sets the formula and revises it. But by and large, provincial governments and local governments heavily depend on fiscal transfers from federal level. And this is one thing during the pandemic response, provincial governments especially have faced this challenge, lack of resources. As we have, out of 7 provinces, 6 provinces have the same ruled by the ruling party that has been ruling in federal government. Only 1 province which we have ruled by other parties. And in Nepal, because the hierarchy exists, so the provinces which are ruled by the ruling party in federal government do not have much, space to express openly their dissatisfaction, but province 2, which is ruled by other parties, have been expressing its displeasure with the federal government controlling all the resources and all. But all in all, what I would say is for 3 years, the federalization process in Nepal was very slow. But this COVID-19 has given an opportunity to rethink about that. And I'm sure this, after the pandemic is over, the Nepali federalization process will accelerated gain the pace. And this is the positive, I think, we can take from this.
Thanks, Budhi. And I mean, I think it raises a really interesting point, which Anne commented as well, is that even in highly centralized, federations where all the money is controlled at the center, a pandemic shows that you can't just use money to influence what happens in a pandemic. You really can see what local government can do when it normally is being kind of pushed around by money. It may not be so easy to do that in a pandemic, and it might actually show some of the advantages of decentralization or multi-level government. Okay, I want to pass to Ramdas now for some final words, and also maybe ask Ramdas to take Benny's got a provocative question. if you had a blank check, how would you reorganize, or how should the multi-level government have worked in the Indian context?
I'll probably go to Palau or someplace. If I had a blank check, how would I reorganize the?
How would you? I mean, how would you set things up, improve things to help to help improve the response?
Well, there are two set. I mean, the pandemic has hit countries from two angles. One is the economy, and the other is the healthcare systems and the public health systems. I feel more comfortable about talking about the public health angle. Basically, I think, based on what I'm hearing from the other presentations, a more decentralized approach is probably more effective. We tend to forget that populations are very diverse, and someone sitting in a capital city 1,000 miles away making policy and developing strategies has no inkling as to what the ground reality is all about. So you need to not only strengthen or build capacity at the local and level, both at the cities, but as well as the rural areas. But you have to think in terms of giving them the capacity to tax, to develop a tax base to fund the operations. Because if you don't do that, then they're dependent on someone further up the chain of command. And, as in the Indian case, what's happened is somebody makes a decision as to we're not going to transfer these payments, and then the states are in trouble. So we've got to avoid that. So decentralization model is generally one which I would use in the context of public health. And I think the decentralized approach also has ramifications for the way you can bring the economy back online. Because not all regions are affected in the same way. There are regional differences, there are city differences. I think governments are beginning to realize it, that I don't think going forward in this pandemic and in future pandemics, the idea the national lockdowns are going to be feasible. We have learned enough from that. It's going to be more, let's use the word smart lockdown approach more than anything else. So building up capacity at the local level is probably the key to making progress in handling future situations, I think.
Right. Thanks, Ramdas. And of course, an important aspect which we haven't only just really touched on is the broader economic impacts and how multi-level government, who's responsible for the broader economic responses as well.
I do want to make one other point. I've talked about the two areas where the maximum impact is public health and as well as the economy. I think India also faced a unique situation in that there's a standoff between India and China along the northern border, which has taken a lot of resources over the last several months. So that is a third dimension that India is dealing with. And that also is probably a factor behind some of the fiscal issues that we're seeing right now.
Great. Now I want to bring Yasser into this for final words, and also to ask Yasser to talk about this question of policing. To what role has the military played? Has the federal government sent in the military at all to do any kind of enforcement, given the important role that the military has played in the COVID response? Thanks, Yasser.
Thanks. So, I wanted to use these questions that you've posed, very interesting questions, to also kind of, I think an earlier question that was posed in sort of the type question, which was this question about what are the disadvantages of decentralization, right? And that was a question asked, and I think it ties in with exactly what, the questions you've posed, because and including about policing and otherwise. I think one of the key issues is it raises when does decentralization work and does it not work? And to understand that, one needs to understand the context in which decentralization is happening and the clarity with which the powers are actually distributed, right, between the federal and other governments, right? And in Pakistan, we've seen problems on both those fronts, right? So one of the, you mentioned earlier on local governments, why Pakistan has had such limited local government experience. Well, one of the reasons is because Pakistan's political parties have tended to be organized around at the provincial level. Whenever there's been a military dictatorship, their first priority has been to devolve power from the provinces to the local governments as a way to break the power of the political parties that are organized at the provincial level. So local governments have often been a cynical exercise in breaking party politics, and therefore when you have a democratic structure, they're immediately skeptical and suspicious of the historical experience of local government. Even though local government has a very positive role to play, it's this historical story of suspicion of local government that has meant that parties that are otherwise democratic have always been deeply skeptical of further decentralizing part of the local level, even though it would arguably benefit all policymaking, especially in the emergency, right? So that's one point where history matters, the history and context in which decentralization happens. The other part is also about the clarity of distribution of power, right? If you're going to distribute power, it has to be done in a way where the powers are very clearly allocated, who's in charge of what and where, who can check who and where. And often when you have, as you, I think, pointed out, you have a major constitutional amendment, that sort of overhauls the system, which is what happened in 2010, there's still a lot of questions that need to be settled within each subject as to who has power over what. And one of those issues was policing, right? So in Pakistan, a big question was who's in charge of what aspect of policing. So policing appointment powers were given to the provinces, but criminal procedure to the federal government, for example, right? How does this play out? Who has power over what? And you have these constant battles going on about who can appoint the head of the police, what kind of powers do the provinces have over the police versus the federal government. And that becomes usually consequential in a time like the pandemic when policing is such an important issue. And so there was often clashes over who is responsible for what aspect of law enforcement in this period. And this is especially interesting in the context of the city where I'm from, which is Karachi, and Karachi really shows how complicated multi-level government can get. Because in Karachi, you have a local police force run by the provincial government, but you also have a huge presence of a paramilitary force run by the federal government. And they both operate in tandem, right? And there's often conflicting dual responsibilities. The Rangers were given a lot more powers during the pandemic, but it was very clear, it often became who gets to do what in that time. So the Rangers would want to take on certain areas of law enforcement, which they thought would be, better for their skill set, but also they want to put the police in positions where they would be at the front lines, or they would handle things like disciplining small populations and communities, right? So there was always this question about who should be running different aspects of the policing. Should it be the paramilitary troops in Karachi? Should it be the police? Who has what responsibilities? And I think that always confused responses in Karachi to the pandemic. So again, it's this question about the clarity of the distribution of power, right? Decentralization works when it's very clear who has what powers, what different law enforcement agencies can and cannot do, what the federal control over law enforcement is and isn't, right? And what the provincial level is, and the context in which decentralization happens. Is decentralization mainly a tool for concentrating power in different parts of the government or breaking certain power structures, or is it something more meaningful about creating a more representative and policy-making wise, robust system or not? And I think that's what I would, leave it at.
Great, thanks, Yasser. I think this conversation could go on for a long time. Unfortunately, we have to bring it to an end. It's been very interesting, and I think has brought in a lot of really interesting comparisons with our first two webinars with respect to the relationship between emergency powers and how they play a role in the relationship between multi-level government, how different multi-level governments perform, as well as the way in which the partisanship and dialogue, or in some case conflict, between different levels of government are used by different players to respond in both positive and negative ways. And I think the final point is to make, I think, before we wrap up, really is to really echo Yasser's point at the end, which is to say the importance here of, we're in a pandemic, we're in a global health crisis, but how strongly the context in the history matters, and how different institutions are set up, and how multi-level government is of course not a kind of, it has its own kind of logic and its own history in each context, and the really important ways in which that plays, and the way the pandemic is really exposing some of those fault lines and how they operate. So I'm going to wrap up here. We're going to have our final and fourth webinar next Thursday in a week's time, looking at the question of independent institutions as well as international institutions. And I would like to thank our four panelists for extremely interesting papers, and everyone's interventions and questions for, I think, leading to a really interesting discussion today. So thanks again, guys.
Thanks, everyone.
Thank you.
Thank you
Bye.
very much.